Jamie's been studying these numbers for a long time and is quite active on social media, highlighting the numbers, the quantities. Jamie, a very good afternoon to you. Thanks for being with me on Tice Talk. So you've been looking at the significant number of excess deaths now on a weekly basis throughout much of this year, and you're pretty unhappy with what you're seeing. Tell us a bit more,
Richard.
Jamie.
Yeah, good afternoon. So what excess deaths are is where you kind of look at how many deaths you're seeing across the country, and then you can compare it, as you talked about there, Richard, to kind of before the pandemic. So what you can adjust for is we have actually got kind of an aging population. We've got a lot of baby boomers now who have hit that kind of ages 70 plus from the Second World War. And because of that, we would expect kind of more deaths. So what I've been doing each week when I'm looking at the figures is, and you can see the chart on the screen there. I think it just popped up, but it's just vanished, I think, Rich. But
what is the chart on the screen, everyone?
Yep, there it is. So what you've got is that the white line that you can see, people are listening on the radio, it's basically a chart showing how many deaths you would expect to see for the time of year, which is the white line, and how many deaths we are actually seeing, which are kind of the orange bars. And now for half a year, we've been seeing higher than expected deaths across the country. Now, the concern for me with this, as you talk about, not many people are kind of covering this. We can look at the kind of the causes that are behind a number of these as well. And if you look at data from the Office for Health Disparities, we are seeing higher than expected deaths for heart issues. And then you can start thinking, well, the natural question is what's going on across the country? Well, if we look at the NHS figures, and we do know that over the last half year, the NHS services have been struggling. We've been seeing kind of record ambulance call-outs, delays for ambulances, delays for people being admitted for surgery. And we've had the figures out this week on waiting lists going up, Richard. And one of the kind of striking numbers there is if you're looking at people who are waiting for heart procedures for more than a year, now this isn't just, you're waiting for a few weeks, this is more than a year. It was never zero, but close to zero before the pandemic. Now, if you look at the figures, over 5,000 people have been waiting for a heart procedure for more than a year. So if you've got more people waiting for a heart procedure for more than a year, more people dying with heart issues, and more deaths than what you would expect, it does seem to be kind of some of the NHS performance could be causing some of these deaths that we're seeing.
And this is the big thing that you're concerned about, is the number of cardiac-related deaths, and in particular age bands as well. What's going on there? Which age band were you focusing on?
Yeah, so we have seen two mini waves of COVID. We saw one kind of throughout the summer and very early in the early autumn as well. And so if you take out deaths that are linked to COVID, so that's where a medical practitioner has said that COVID potentially contributed to the death. If you take all of those out and then you look at deaths by age group, the concerning for me is kind of people around the ages of 30 to 59. We are seeing higher than expected deaths when you take any COVID out. And we got 10% higher than average when you're just looking at 45 to 49-year-olds. So those are the concerning things. We had daily, Richard, as you know, for 2 years across BBC, ITV, Sky, how many people are dying within 28 days of a positive COVID test. Very little I've seen covering this issue around heart deaths, people in their middle age dying, and obviously link this to the NHS performance.
So on an average week recently, in the last 4 or 5 weeks, above the age-adjusted 5-year average, how many excess deaths are we seeing sort of week by week at the moment?
Yeah, so it's easily running at around 500 to 600 that we're seeing. It would be more if you look at if you don't adjust for the fact that the population's kind of aging, it would be more than that. But we are seeing this, and I think another concerning part, Rich, is where they're dying as well. So if we actually look at the place of death, if we look over the course of the pandemic, we've seen about 30% above average people dying at home. That's continuing to happen. And recently the ONS did a report on this, and they've been kind of highlighting that people are dying at home more than what you would expect, fewer people dying in hospital, fewer people dying in hospices. But I think there's a concerning bit to me is that are people dying at home not getting the treatment because they've stayed away from the NHS?
So if it's 500 or 600 a week, that's nearly 100 extra per day who are dying, many of cardiac-related issues, and you're saying that many of those are excess deaths at home. So you then have to answer, so who's asking the questions as to why? What are is it ambulance delays? Is it blockages in hospital that's preventing people being properly looked after? Is there any risk of it being additional vaccine harms? Who's asking these questions to try and arrive at the answers?
So if you go back about 2 months, 3 months ago, people were calling on the Department of Health to look into this, and they issued a kind of a statement saying that they've called for an investigation. So that would be where the UK Health Security Agency and the Office for National Statistics should be stepping in on this. I think, this is going on every single week, and I think it's not unreasonable now, Richard, to say, it was about a month before Christmas to try and get some answers before the end of the year, because this is going to continue. That investigation they said they called for, it's not a very difficult job. You just got to look at the data. I haven't got access to the individual patient level data. I can't do the analysis, but there are people in government departments who can do this, and we need some answers.
But the truth is, you are doing the analysis based on the data you can get, and there's a problem. There are serious issues that need answering, but it doesn't seem that there's any appetite within the health department to answer these important questions.
No, and if it all comes back down to potentially what we're seeing is there could be different factors why we're seeing more people kind of falling ill. But then if people are falling ill, it's no coincidence the way you do look at the performance of the NHS at the moment, where ambulances are struggling to get out to see people. You're hearing stories of hours and hours and hours and sometimes days for a delay. We've got record patients in hospital who can't be discharged because of the lack of care in the community. And if you do get to the hospital, if you do get seen, the delay in actually being admitted into the hospital if you've got something seriously wrong with you is going up. So there's two parts of this, Rich. There's obviously why are there more people having issues with their hearts overall? And we look at the waiting lists there, and we know more and more people are waiting over a year. But then if we answer that question, the next question is, are you more likely to die if you've got one of these issues because of the way the treatment is going across the country? So those are the two parts that need looking at, and the government should really be prioritising this.
I find it extraordinary that they're not doing sort of weekly press conferences, frankly, addressing this and addressing people's concerns.
Well, of course, and the thing is, if it all comes back down to the performance of the NHS itself, that kind of starts laying on the government. It wouldn't just be what's gone on over the pandemic. Jeremy Hunt, the Chancellor, is going to be doing his autumn statement this week. Remember, one of the longest-serving health secretaries, he's admitted himself he's failed in terms of the NHS workforce. People can talk about giving more money to the NHS tomorrow, but if you haven't got the staff to kind of treat these people, that's going to cause a problem. And this is probably going to get worse if nurses go on strike, Rich.
A message just come in, Jamie, from Rita, who says, I go to all my appointments, but for 3 years and next year, my cardiologist appointments are via telephone. I've waited 5 months for my yearly scan. By the time I get my scan, it'll be time for my next appointment. So in a sense, that's missing a complete year's worth of scans. It's just not right, and it's sadly it's ending up with people dying years early.
No, indeed. And this could go on and on for a long time. We're not really seeing at the moment, Rich, very more kind of deaths from things like cancer. Now, that could build up over time when you start looking in terms of people who have kind of missed some diagnosis. It seems to be more linked to these heart issues and strokes at the moment. That seems to be the critical bit. But this could continue to go on and on and on.
I fear it will, Jamie. And I've got another message here. I was given an urgent cancer referral to be seen within 2 weeks. That was 11 weeks ago. Unbelievable. Jamie Jenkins, thank you so much for your thoughts there on the really concerning number of excess deaths week after week for about half a year now. We really do need some answers from the Health Secretary, from the Chief Medical Officer, as to what is going on.